Hi. Alright, so I'm going to be treating Bruce Robertson from Filth, and but before I treat him, just kind of go over a little summary. So Bruce Robertson, uh, and he has bipolar, dissociative identity disorder, and like drug addiction, uh, you know, alcohol addiction, and sex addiction. Uh, he also hallucinates. But let's kind of get into treatment. So this is one of his hallucinations. At one point, at a few points in the film, he does cocaine and he goes into kind of like a hallucination state, and he sees his doctor, who he goes and see, and his doctor prescribes him actual pills, but he never takes it, and you see it in these delusions, and you see kind of a weird version of the Doctor. So that that's him. So let's treat him. Um, lithium carbonate. All right. So I'm gonna move this a little bit to kind of show you what the pills look like. So the green pill right there, that's the pill that they use in the movie, and it looks a lot similar to the actual pill, lithium carbonate. And that's what it says on the capsule. It's somewhat similar. It's different coloring, but it's whatever. But yeah, that is the labeling and stuff, and this is just some facts. It should be taken 2 to 3 times a day with food. It was invented in 1948 by Dr. John Cade. Some side effects and what it does, and it helps kind of calm down his bipolar disorder. And in the film, they know he has bipolar disorder, and they give him these pills, but he never takes it. So he definitely needs to take his pills. Rehab. This is kind of obvious. I put some sites to where there are some clinics in Scotland, but I kind of explain the process of rehab and what they'll be doing, and I kind of go in the history of rehab. There's not an exact person. It kind of goes back to Native Americans, where they put men in like sober circles, so they stay in that, and they kind of think about their ancestors, and their ancestors help them, and that's kind of how they got sober. But they just basically waited out till they became sober again. Um, but rehab was really made in like 1840, and it was like sober houses. So group therapy, and it's a big thing in rehab, and alcohol anonymous, AA. But group therapy, and basically either there's an intervention in family and friends, kind of help someone, they address the situation of someone's addiction, or there's an actual group therapy where there's one psychologist therapist with a bunch of different people who have the kind of same situation, where they're all addicted to something similar. Uh, Individual psychotherapy. I think he definitely needs this. So basically, um, he's had a bad childhood. He saw his little brother get killed, and he blamed himself. I mean, he did kind of kill him, but I don't think that was important. But yeah, it was created by Walter Cooper Dendy in 1853, and usually they said like 15 to 20 sessions is usually a normal thing, but he's got a lot of things going on with him. Um, if he was still alive. Yeah. Oh, did I mention that he committed suicide? And so basically, we're kind of going treatment off if he was still alive, and someone caught him before he killed himself. So, but yeah, and this will usually help him get over his dissociative identity disorder, because this helps someone kind of find themselves, individual. So, um, what's next? Uh, chlorpromazine. I think I said that right. Obviously it's antipsychotic, but yeah, it's the first one, and it can treat mental illness, behavioral disorder, uh, on these different things, and it should help. I looked it up, and it should work with the lithium carbonate, and it shouldn't interfere, or kind of help with like certain things, so it should be okay. um I saw that it was it's prescribed 2 to 4 times a day, or maybe your doctor says otherwise, and that's with like any pills really. And it was created in 1950 by Paul Charpentier. um but yeah, uh it's treatment, and I guess it's a lot harder to diagnose because there's a lot of different things, and with treatment, uh it's really simple, and you should know what to do with all these different things, and I think this part was easier and a lot quicker, as you can tell. So yeah, but yeah, that's the diagnosis and treatment of Bruce Robertson.